is Barb Spurrier. I serve as the Administrative Director of the Mayo Clinic Center for Innovation, and I am so thrilled to welcome you to our first ever Mayo Clinic Think Big Challenge. I'm joined by my colleague Jim Rogers, who serves as the Chair of Mayo Clinic Ventures.
Hello everybody, how are we doing tonight? This is going to be a little different than probably anything we've ever done here before, and we're really, really excited about it. We're excited about it on multiple fronts. From an innovation and entrepreneurship, we really want to be able to see what's going on across the country. And we were very successful in this current iteration to see 134, Barb? 134 different companies submit from all over the country. 34 different states were represented. That's the sort of thing we want to see. We want to be able to have a free flow of exchange of ideas. From a Mayo perspective, it's really important for us to stay on the cutting edge of medicine, to be able to see ideas, to be able to iterate on ideas, to be able to partner and collaborate. So I want to thank you all for being here tonight. I want you all to fully participate, and most importantly, I want you just to have a fantastic time.
Great, great. So just a couple of notes before we get started. Before we begin the challenge competition, we have an entrepreneurial warm-up act by Omar Ansari, who serves as the CEO of Surly Brewing Company. Following Omar's message, he will turn the program over to Margaret Laws, who will serve as the MC for our Think Big Challenge. And we are so pleased to welcome Margaret back to the Transform stage. After the event, we'll really get the party started at the historic Chateau Theater, just a few blocks from here, with craft beers from Surly, great food, music, and most importantly, our awesome Transform audience for lots of networking. The Chateau Theater, the historic Chateau Theater, was designated at the height of the silent picture era. Yet almost immediately after opening, it successfully adapted to the disruptive technology and the Industrial Revolution going on at the time in talking pictures, color film, TV, and video. It had an international focus. Following America's involvement in World War I, a new appreciation of international design developed. Chateau Theater's design in the style of a French village, influenced and inspired by Mayo Clinic and Rochester's outreach to Europe in the Great War. We think it's really outstanding that Transform and the party will be at the Chateau Theater, stepping into the future and envisioning new ways for all of us to work together and engaging. Thanks to Matt Dacey, our Mayo historian and our very good CFI friend and colleague, for the history lesson about the Chateau. One more note before the introduction of Omar. I want to acknowledge a very special company, Avia, who has been our partner with the Mayo Clinic Think Big Challenge. Avia is healthcare's only provider-led accelerator, addressing our most pressing challenges by working directly with provider organizations to identify and implement the best emerging technology solutions at scale. Thank you to Eric Langsher, the founder and CEO of Avia, to Leslie Wainwright, and to Janice Louie for the tremendous participation and support. So just a hand to Avia. So now to welcome Omar Ansari to the stage to share his story. Whatever customer you're thinking about, whatever their needs may be, whatever market you're thinking about entering into, the business model, the market, the scale, so many of the rules are the same, and it's so good for us in the health and healthcare industry to learn from others. So here we have Omar Ansari, who's figured it out. Omar is the CEO and founder of Surly Brewing Company, who turned his hobby and obsession into a multi-million-dollar business. From being given a home brew kit in 1994, and we heard this morning from our friend from MIT about the importance of kits, maybe not exactly what he had in mind, but a homebrew kit in 1994, Omar worked to convert his parents' abrasive factory into a craft brewery in Brooklyn Center in 2006. Nearly a decade later, Surly Brewing has become one of the biggest and most popular craft breweries in Minnesota, boasting a $34 million destination brewery in Minneapolis, with a beer hall, event center, and fine dining restaurant. And with Surly Beer on taps now in shelves all over Minnesota, Iowa, Wisconsin, and Chicago, and soon to be tonight at the Chateau Theater. So please give a warm, transform welcome to Omar Ansari.
Thank you. Thank you very much, Barb. Well, thanks so much for inviting me out to speak tonight. Obviously, you guys are taking a different look at how things happen because I don't know if many brewers have spoken to a conference of healthcare industrials or folks, but I'll do my best here. But perhaps there's maybe someone had a little knowledge about my background. Actually, my wife was an ER physician at North Memorial. And as our kids were growing up, and my youngest is 6, so they were always trying to figure out what mom and dad do. And it's always a little tough when you got little kids to really explain it. So the way we really broke it down for a lot of years was, mommy makes people feel better, but daddy makes people feel happy. So maybe there's a connection there, but. You'll have to excuse me because I'm usually used to when I'm talking to people, it's usually at the brewery. I have a beer, which makes it a lot easier for me. You have a beer, which makes it all a lot more entertaining. So, but we'll talk a little bit about Surly, I guess why I'm here. As Barb said, I got the idea for starting a brewery in 2004, opened it in February of 2006, and at that time we had 2 employees. Currently we have about 280 employees in both our Brooklyn Center, our new Minneapolis brewery, and our St. Paul warehouse. In those last almost 10 years now, we've also changed the state law, which was pretty transformative in sort of changing the beer scene across Minnesota. We're seeing small craft breweries around all over the state, and certainly in the Twin Cities, and almost every neighborhood is now getting its own small brewery that kind of really supports just that neighborhood. So the industry has changed a lot. We were the second brewery in the Twin Cities when we opened. I think there's 40 now. I know we have about 5 on our street on University within about 3 miles of our brewery. So things have changed a lot since we've got going, but certainly all for the better. What I wanted to talk about is what makes a good innovator, but really what made a good innovator, what the lessons I was able to take, the lessons I had that I can share with you. I'm never going to tell you, obviously these are the keys. I'm not going to write a book and tell you here's what you got to do to make your business successful or how you approach things, but certainly some things that I can take away and share with how we built the brewery. So I think the number one thing is that you don't have to do it the way things have been done. It's one of the keys of the Surly way, which is a little saying we have at the brewery. It's kind of seemingly makes everything harder, but always trying to shoot for the stars. But there's a lot of tradition in industry because banks want to back a business they know. People want to buy from someone they know. But that can be really restrictive. And I'd been working with my parents since I was a little kid. They had a family business. My mom and dad are immigrants and came to the Twin Cities and opened up a company that made grinding wheels, abrasives. And I started working there after college full time. And I was unfortunately running it into the ground. So we got smaller and smaller every year, which is not a long-term strategy for growth. So luckily, history is not always an indicator of how things are going to go. But there was only one brewery in the Twin Cities, and it didn't seem like it made any sense for another brewery to open at that time. When I told friends about this idea, they usually said, well, why don't you have someone else make the beer for you and you can just sell it? It's a horrible idea. No one's going to, the market's too crowded. You're not going to be able to do it. But it seemed to be, since no one else was doing it, maybe that was our opportunity to get in there and do something different. It was certainly a fantastic thing to try and transform an old Rust Bowl kind of family business into something new. And certainly one of the best, the highlights of the whole thing, the best handshake I ever got was when I told my dad the plans of opening a new brewery. Kind of meant they'd have to come back and run the business. And he gave me a handshake and said, welcome to the club, you're an entrepreneur now. You're going to take this on yourself, which was really meaningful since I'd always been kind of running his dream, but to sort of start off and take off on my own. As far as doing things differently, one of the big things we did when we started was we started canning our beer. We did that in October of 2006. And that goes back to something we do at Surly. We've always tried to take a fresh look at things. Like, let's not just do it, let's not just put our beer in bottles because every other brewery has done it. Let's take a look at all the options and see which ones are best for us. So whenever an opportunity comes along, it's trying to figure out if it makes sense for us. Let's not just do it the way it's been done, but let's see if we can find the best answer for us. And for us, that was putting it in cans, which was certainly a pretty bold move at that time. I certainly agree, like most people, the only kind of beer you find in a can is pretty bad beer. I told Todd Haug, our head brewer, when he said, someday I'm going to get you to put our beer in cans, I said, that'll never happen. But we did some blind taste tests and found out that actually beer in a can can be pretty good, even better than in a bottle, so we kind of went forward with it. I remember a couple instances. One, this is right before we were about to get into it. I was at Pizza Luce talking to a couple gentlemen, a younger fellow and an older gentleman, and they were both drinking craft beer, and I asked the older fellow what he thought about us putting our beer in cans, and he said, no way, there's no good craft beer in cans, it's all in bottles now. And I asked the younger guy, and he's like, cans would be pretty cool. I drink Monster, I drink a lot of the energy drinks, I drink PBR out of a can, so it was really sort of seeing this paradigm shift in drinkers out there and realizing we wanted to be part of what new people were thinking, not necessarily what had been done for a long time. So, and also sort of the way we designed our cans are a little bit different. They're a little edgier. I think you'll see them at the Chateau tonight. I know I will have one. And a lot of people say, well, they don't look like a beer can. It looks like an energy drink. Back to that same thing is, well, why do all beer cans look the same? They don't need to look the same. They don't need just to have the name of the brewery, Budweiser, Miller, Coors, Surly on the front. You can do a lot more with it. So same thing of, what else can you do? Can you do something different? Because if you're going to do it like everyone else, what else do you have to offer? Because if you're just going to be a little bit cheaper, that's great, but it's kind of a race to the bottom because someone else is going to come along that's probably going to be cheaper than you, which is really we've ever found a great business model to shoot for. So something else we did that we think was a little bit different is we designed a brewery unlike anything else. Let's see, I think we've got a photo here, if I can use this clicker. Oh, that's the old brewery, so that's our old abrasive factory with folks lining up for the first day. We were able to sell growlers, half-gallon jugs of beer out of the brewery. So you can see kind of an old industrial site. And we'll go to this one here with, oops, I don't have that. Well, where was I? Sorry. Well, changing the brewery, let's see. Well, there's the picture of the brewery. So the picture of the brewery was certainly far different when we had some designs out there. It was far different than what anyone else had seen. People were thinking a brewery's going to look like Grain Belt. It's going to look like the old Shell's brewery. So when the first drawings came out, we did it at our 7th anniversary party. Didn't really go over that well. A lot of the comments were pretty negative. I think, some of them were, looks like a VCR, looks like a North Korean bunker. Looks like a dystopian view of the future. So they weren't really as positive as we were hoping when it came out, but it goes back to trying to do something different and trying to realize, we don't build breweries like that anymore. We're not looking to build a brewery to evoke something of 100, 200 years ago, but this is how we're going to do it now. And trying to figure out what worked best for us, what worked best for that public space that we wanted to bring people into the brewery. We have a 250-seat beer hall and a restaurant and event center. You can't do that in an old brick-style building, and breweries just don't work like that anymore. So it's certainly taking some arrows from what people think when they think of what a brewery should look like, but it's having the conviction to do something different and making it work. Changing the law is another a big part of trying to do something different. We wanted to build this new brewery. We got the idea after going to Europe, but in Minnesota, a brewery could not sell someone a glass of beer. So the challenge was how to figure out how to get this law changed. And I think that's one of the big keys, is the obstacles have got to get figured out with strategy of some sort. And this was a huge obstacle for us. If we couldn't get this law changed, we weren't going to build a brewery just to build a bigger brewery. We wanted to build something big, something different than Minnesota had seen. And really the whole strategy was months of me trying to figure out how to make this happen, because usually beer and liquor bills are quashed at the state capitol before they even get heard. I know a Star Tribune reporter said he really wasn't interested in covering it because they never go anywhere. And I remember the day after the election, I think, so that'd be early November in 2012, 2010. The Republicans in Minnesota had taken control, and front page of the paper said, we heard you loud and clear, we need to create jobs. And I was able to figure out this is a jobs bill was really what this was. So changing this law meant we could create all these jobs in Minnesota as opposed to across the river in Hudson. So trying to find that way to find the answer, because you're not going to find someone else that's going to give you the answer. Your attorney, your accountant, your marketing folks are certainly going to bring you lots of ideas, but as the entrepreneur, it's going to be up to you to figure out what the final answer is. Because one of the other key points is about risk, is about being a gambler. And I remember growing up, always the message was always, if you're going to be an entrepreneur, you got to love gambling and taking chances and being willing to do anything. And on all those tests we all have to take in high school, I always scored low on that, so I figured I could never be an entrepreneur. And around the time 2004, when I got the idea to start this brewery, I think I had it, after spending 6 months working on it, I had enough knowledge about it in my head that it didn't feel like a gamble. It didn't feel like it was this crazy idea and who knew if it would work. So when people would ask me at that time, like, well, how do you feel? Are you really worried? I'm like, I think, things can go wrong, but I'm pretty sure we got this. I think I know the market. I kind of understand the margins enough. I know what it takes to make good beer. I know what the scene is like in other parts of the country. I know that we don't have enough craft beer here, and I think it's going to get here. So it's knowing your industry, it's knowing the market, it's knowing what you do. Because once again, if you've got to have that something, right? You've got to have that idea, you've got to have that conviction, because no one else is going to have it. If it's yours, it's certainly got to be your baby. And I remember talking to my father about that. He helped me. It was a great sounding board since he was an entrepreneur in the beginning. And I asked him early on, I said, Dad, how do I figure this out? Like, how do I get out? Like, if things don't go well. And he kind of looked at me and he goes, well, you don't plan an exit strategy. He's like, that means you're planning to fail. So that means you've failed already. She's like, there's no failure. There is no do-over. So don't worry about an exit strategy, because you don't need one. You shouldn't have one, because you got to make it work. And once again, it's all back. It's back on you, the entrepreneur. It's that person with that new idea. Other people out there that your advisors are great, but it's still going to be yours, and you've got to be the one that makes it happen. One other quick piece is sort of the dream no small dreams idea. Certainly when we opened the brewery, the business plan was make great beer and meet payroll, which we did. And that was a big enough dream at that point. But as time went on, we kind of realized maybe our dreams could be a little bigger. I went to some conferences. One looked a lot like this today, an Inc. conference, and got some ideas that maybe we can do something a bit bigger. And that's when that new brewery idea came up. It wasn't just a bigger brewery, but it was changing the law so we could sell people a pint of beer, immerse them in our surly culture, show them something completely different. And it was a huge idea, it was a huge dream, but that's kind of the point. I mean, that's why I think everyone is here, because it's trying to change how things are done. Not just, it's always great to tweak it a little bit, but there are ideas out there, and if you're fortunate enough to be in a position to try and grab them, like I always thought we were, I sort of felt obliged to go do it, because at least seeing my parents' business and how they struggled for a lifetime of running a small business, when I sort of saw the success we had, I kind of realized I had an obligation to go and sort of shoot for the moon, because it just doesn't happen a lot. And to wrap it up, I want to say when I first got the idea, the day I got the idea of starting the brewery, it was a Saturday in 2004. I was watching my son Max pad around the house. I was wearing a robe, drinking a cup of coffee, and I was a big home brewer at that time. So I wasn't brewing that weekend, but I was thinking about brewing the next weekend. So I was flipping through a homebrew catalog. In the centerfold of this catalog was a 2-page spread for a 3-barrel brewery for sale. So that makes about 6 kegs of beer at a time. And in there it said it was for the home brewer gone wild, or the bar restaurant that wants to add a brew pub. So the light bulb literally went on like in a cartoon, and I got out a notepad, started writing down reasons why I thought I could make this work. And I cracked open a home brew or two, and by the time my wife got home from her shift, I had a beer for her at the door and a notepad, and I said, honey, I got a great idea. I think we should start a brewery. And I said, I got a list, so we'll go over it. And I sat down and explained it to her. And kind of at the end of the night, she says, well, I guess we'll do it until we run out of money or someone says no. And that hasn't happened yet, and I hope the 6 contestants up here, at least you can all kind of continue to keep going, and hopefully no one says no. So thanks. I'm going to introduce Margaret Laws, our fellow entrepreneur and host for the Think Big Challenge.
Well, hello, everybody. Thank you for being out here on a Thursday night. I'm sorry we don't have surly beer for you, but hopefully we'll see you all at the Chateau later on tonight. I'm really excited to be involved in the Mayo Clinic's first ever Think Big Challenge. And just wanted to say a few words about why I'm so excited to be here at Transform and to be working on this challenge tonight. About 6 years ago, I launched a social venture fund investing in technology and service companies to try to improve access to care and lower cost of care with a big focus on low-income populations and the underserved. This July, I took over as CEO of Hope Lab, where we focus on the power of people and technology to improve health and well-being, and we have a strong focus on kids and young adults. And one of the exciting things about the people power theme of this year's Transform conference is that our founders, Pam and Piero Midyar, have a strong belief in people power, in the notion that people are inherently capable of making a difference and are drawn to help themselves and others when they're empowered with the knowledge and the tools to do so. So it's exciting tonight to be here. So many of the stories that I've heard resonate with what we're trying to do at Hope Lab. An amazing a range of different ways that people have told their stories over the past 2 days. And I'm really excited, actually, tonight to tap into the people power of all of you to help us select the winners from a great group of companies. So our expectation is that you'll be active and participate throughout the event. And my first job is to orient you to what is to come. So in launching the first Think Big competition, Mayo Clinic extended an invitation across the country in 2 specific areas, Got Health and I Am Not My Disease, both of which tie to this year's theme of people power. We're overjoyed to have 132 quality submissions, and we're just really excited about the level of innovation and the participation in this year's challenge. We had 11 semifinalists. Our judging panel narrowed the field down to 11, and we then went to 6 companies that we have here tonight. So the 6 finalists, 6 participants in tonight's competition are Care at Hand, Day 2 Health, Siva Technologies, Livongo, FizzIQ, and WellPepper. So let's give it up to the community of innovators and the companies who are finalists here tonight. So now I actually want to turn it over and introduce you to our judges. The judging panel tonight represents clinicians, technology experts, and venture leaders from both the Mayo Clinic and Avia. They got us this far. You will now take us the rest of the way.
Everyone.
So what happens tonight? You'll notice our stage set, circa 1970, in the style of a dating game. So just a quick show of hands, how many of you remember the dating game? How many of you were, okay, we got a pretty good crowd. What I will say is that I hadn't seen it in a while, and I would encourage you to go to YouTube and see the likes of Arnold Schwarzenegger, Farrah Fawcett, and Suzanne Summers participating in the game. Pretty good blast from the past. So we wanted to use the dating game theme because we feel like for many of you in the room, finding an entrepreneur to work with or a company to work with feels a little bit like a blind date. So our job tonight is to help 2 people who are seeking solutions to their healthcare challenges to find their best match. So what you'll hear tonight is the companies directly talking to these individuals in the spirit of people powering health, as opposed to talking in the language of venture investors, payers, providers. And it's our hope that through this, you'll see the tremendous potential that these companies have to transform the lives of people and help them better manage their conditions. So what should you be listening for? Which company will have the biggest impact? There are 2 different competitions, one for the persona of God Health and one for I Am Not My Disease. And what will the results of your efforts be? There are 2 prizes tonight. We want to thank once again the Mayo Clinic and Avia for putting this competition together. each category will have a $50,000 prize. So at the end of the competition tonight, through your efforts and your voting, we'll be awarding two $50,000 checks. So that's what we've got ahead of us tonight. And I'd like to quickly turn it over to our first challenge, Got Health. I'm gonna get in costume. We gotta have a little fun. So I would like to actually invite onto the stage now our first guest and my great friend, Greg McCool. By way of a little quick introduction, Greg is experienced in physician-patient communication, shared decision-making, and person-centered approach to innovation. He deeply understands the importance of listening to the patient and understanding the patient as a whole person, and has built a company, Patient Wisdom, that does that very thing. And for this evening, Greg is going to personify the complexities of someone truly trying for themselves and for their loved ones to live at the top of their health potential. Let's give a huge Think Big welcome to Got Health, Greg.
Hi, Margaret.
Hi, Greg.
Nice vest.
Thank you. I think the dating game never had a female host, so there were a lot of turtlenecks and blazers and long sideburns, but I'm trying to do it with the vest. So we want to talk a little bit about you, Got Health, Greg. You've taken the time to highlight a few things about your life situation for the room to see. Is there anything else you'd like the audience to know?
Well, when I was typing my responses into the Patient Wisdom screen, I mentioned the sandwich generation, and can just give a little more information about that and how I'm experiencing that. My mom was diagnosed with pancreatic cancer just before Christmas, and I've been working ever since then with her to help her through this and our family through this however I can. And around the same time, my dad started losing his sight, which made driving a problem. So we're on the parent side dealing not only with some rather significant health issues, but also with social issues, if you will, transportation, who's going to clean the house, that kind of thing. And at the same time, trying to make sure that I'm present for my family, my immediate family in terms of wife and kids.
So what motivates you, Greg?
I think athletic challenges motivate me, although it used to be that I'd finish a hard thing and say, how did I do? And now I'd finish it and say, how did I just do that? That was really hard. And working on solutions to big problems. I think of it as kind of radical common sense is the approach that I use. And then I would say trying to be present for my family and friends.
Great. And what frustrates you?
I think the fragmentation of healthcare is something that we see every day, that we're trying to work on my mom's care. The fact that a lot of things that ought to be done remotely can't be is also a challenge. And I also think that despite very, very good intentions, the patient perspective, the family perspective, just the person perspective is often ignored too often.
And what most concerns you as you're thinking about who can help you with some of these issues?
Making sure that my parents get the care that they need is paramount. And then, and we heard John talk about this yesterday, but given trying to help everybody else, oftentimes I find it hard to take care of myself given everything else that's going on, and that is a real concern.
Great. So, Greg, if I'm hearing you right, you're seeking solutions from these companies we have here tonight that can help you and your family move towards healthier lifestyles, and you're seeking a way to help providers who work with you become more active partners in supporting your health.
You bet I am.
All right. Well, that's great news. We've got 3 companies. They've been waiting behind the soundproof curtain so that they haven't been able to know what was going on. And they might have just what you're looking for. So I'd like to introduce you to 3 companies, Day 2 Health, Care at Hand, and Siva Technologies. So let's start with Day 2 Health. Why are you a good match for Got Health, Greg?
Well, Greg, let me start by saying that I really feel you. I mean, not in terms of this competition, but in real life. I have 2 kids in college, 3 kids at home, a father who has Parkinson's, a mother who just went through a breast cancer bout, and I'm running a very small new healthcare technology company. So I really understand the stress and the care that comes with your life. You say sandwich generation. To me, sometimes it feels more like a vice than a sandwich. And if you and I knew each other 10 years ago, when I was a partner of a marketing agency whose primary client was Harley-Davidson, I would have had something really interesting to sell you. An experience of freedom in the open road, of escape, of renewal, of rejuvenation. Oh, and tattoos as well. But the healthcare system doesn't have anything like that to offer you. That's not how they think. Most of the time when they communicate with you or with your family, they're communicating about themselves. They're communicating about what you need to do, where you need to be, and where you need to be there. And to be very, very brutal about it, very, very brutally honest about it, they often don't even see us. It's as if we don't show up because, Greg, because we're not sick, because we're not filing claims. But you show up every day. You show up with your parents, you show up for your children, you show up with yourself thinking about the healthier behaviors that you know are going to be important, even if those benefits don't come from down the line. The challenge is you just can't help the health system see you every day, see what you see every day. And even more challenging, the health system doesn't have a good way to come alongside of you every day and help you focus on the things that are most important. And that's why we started Day 2 Health. We started Day 2 Health to help activate the relationship with the person and the provider. And the way that we do that is through a technology that we call the persuasion engine. The persuasion engine is a big data platform that creates a profile of the whole person. And so we've designed it so that it can bring in clinical data, it can bring in claims data, it can bring in personally reported data, but it also is gathering insights about the meaning around healthcare for that person and helping to understand the barriers to change that that person has. And once they've decided that they want to change, how to overcome ability barriers or motivational barriers. We then have a rules engine that works on those facts, and it creates a stream of daily nudges. And these are truly nudges, Greg. They're not nags, because they're based on proven behavioral science models that marketers have figured out how to use over time but haven't been used effectively yet in healthcare. And the persuasion engine is not an app. It's truly an engine with open APIs, so we can send those nudges into a variety of consumer-facing digital apps and clinical apps. So we could send it to a consumer app that your healthcare provider has created just for you. We could send it through the Meaningful Use portal. We could send nudges into a third-party app like a call center that would release a nudge that's a phone call. And similarly, on the clinician side, we can integrate it into EHRs and into existing clinical workflows. So, Greg, the reason that I'm here is because I think that healthcare should look a lot more like Harley-Davidson. I think it should be customized to the way you ride. And I think it should be powered by the energy and the meaning that you bring to it. Data plus you, that's Day 2 Health.
Thanks, Andy. All right, next up, that was Andy. Next up is Andre, and care at hand, why are you a good match for God Health, Greg?
Well, Greg, after listening to the keynote, I'm afraid you're going to have chronic alcoholism, and we're going to, no, I'm kidding. We're not. I actually love that beer. Care at Hand is actually an essential fit for you, Greg, because we're going to give you the peace of mind that your parents are going to age safely, and also that you're not going to go into financial ruin because an unfortunate catastrophic healthcare event with your parents will make you go bankrupt. In fact, my company was started because my family had just this experience. My parents were part of a sandwich generation. They had to raise me, my sister, and they had to take care of my grandma. My grandma had Parkinson's, and because of that, had to come live with us. This picture is a picture of my grandma and my little sister that was taken a few weeks before we went on a family vacation. We went on that vacation without my grandma because she was too frail to go. We left her at home with a home care aide, someone we trusted. And when we came back, Grandma was fine, but in that subsequent week, she decompensated pretty quickly. We took her to the hospital. In the hospital, we came to find out that she had broken her hip, that the hip got infected, and she ended up in the ICU. And in retrospect, we learned that the home care worker actually observed that she had fallen. She thought it was a small fall and didn't know that she had to report that. And this is someone we loved, we continued to love, and it really was out of her scope of practice to report that. And unfortunately, my parents were put in this position of trying to figure out how to pay for a high-quality long-term care facility or put our matriarch in some kind of publicly subsidized institution. Unfortunately, we never got to make that choice. My grandma passed away because of a ventilator-associated pneumonia. She died because a supervising nurse did not have that tiny piece of information that she had fallen. And that's because the home care worker didn't know to report it. And so I'm inspired, Greg, to make sure that never happens to you and never happens to anyone else. Now, our technology is simple. Our technology is an analytics platform. It predicts hospitalization risk, and it does it uniquely. It does so by taking the observations of these very non-medical staff. Now, the non-medical staff, like this home care worker for my grandma, they help with activities of daily living, care coordination, medication reconciliation, and they interact with our technology by doing a simple up to 3-minute survey. There's up to 15 questions per survey. The survey questions change, and they're derived from a database of over 2,600 and growing questions. Now, about 1 in 5 of these surveys will actually meet criteria to have elevated hospitalization risk. That will trigger an alert. That alert goes to that supervising nurse. And the nurse can now intervene before the problem gets worse and do something as simple as send a visiting nurse to the home, or send, hopefully not, but your parents, Greg, to the primary care doctor rather than sending them to the ICU when it's too late. And so the importance of this is that I want to help your family, Greg, avoid what we went through. I want you to never have to make the decision of, do I not pay my children's college education so I can pay for my parents' long-term care? And Greg, I want to make sure that I give you the peace of mind to relax, to exercise, to take time for yourself to eat well, and you give yourself up a lot. You give a lot of yourself up, and so you need some time for you, Greg. You deserve that, and you deserve care at hand. What do we aspire to do? Well, there are millions of these workers out there. These yellow touch points represent when these workers interact with the consumer. The blue touch points represent the sporadic doctor-patient interaction, and there are so many more and so much less expensive touch points to be had between this workforce. And the opportunity here is I want all of the Gregs out there in the world to have the peace of mind that your family will age well in place and that you can preserve some time for yourself. Thanks.
Thank you, Andre. Next up is Siva. And Andrew, why are you a good match for God Health Greg?
Well, Greg, it's a pleasure to meet you. And after hearing your story, I believe that Siva is the perfect match for you because above all else, we will put you in control of your own health. We'll also give you back the body that your wife married you for and the confidence to bring us home to meet mom and dad. Let me explain. As a world of health-conscious individuals, we are always looking for more things to implement into our lives so we can live longer and more fulfilling lives. Greg, as a weekend warrior, you know what it's like to implement new tactics to optimize the efficiency of a time-crunched workout. But as a quarterback to your parents' health, you also know firsthand the difficulties of balancing the needs of daily health management with the desires of maintaining your autonomy well into your retirement. The sad reality is that there are more people who stop taking care of themselves than there are who are successfully managing their health. So why do they stop? You mentioned that time has something to do with it, specifically balancing work with family, but there are other causes too. Like the internal sense of doubt that's within us all, and it grows when we don't see results or if we experience setbacks. And the inconveniences of our everyday lives, which restrict us from putting forth the necessary time and effort to properly manage our health. Greg, I invite you to think back. Has there ever been a time that you questioned your diet or workout habits thinking, am I even doing it right? Or is it actually gonna help me? And with your parents, has there ever been a time where their care was compromised as a result of you having to cancel an on-site appointment? Well, these problems came to my team and I a few months back, and we started thinking, why aren't there consumer healthcare technology solutions that can combat these? And that's where we come in. Siva brings new levels of confidence and convenience into personal care by by filling the present technological void with outcome-oriented wearables. We manufacture form-fitting garments that detect neuromuscular responses from the entire body and wirelessly transmit them to a mobile device. From there, our software analyzes this data into patterns of optimal performance, understandings of overcompensation and imbalances, and it's all displayed in real time on a gamified interface. These metrics allow you and coaches, trainers, and physicians alike the ability to develop personal regimen and schedules that cater to the specific needs of individuals when either recovering from injury or working out. Greg, imagine you force yourself to get into shape so you sign up for a half marathon next spring. To save time, you may look online for programs or schedules to follow, but how do you know that it's actually made with you in mind? And even more, you're training over an extended period of time. The last thing you and I both want to see is an injury that sets you back. Well, our products are able to understand the precise biomechanics that go into your unique running form and are able to then tailor a specific schedule for you to follow that focuses on your personal strengths and weaknesses, thus optimizing the efficiency of your training. Even more, they're able to understand the data trends of your performance over time and alert you when you're at risk of injury, whether it be from overtraining or imbalances. And Greg, these are the promises that I can make for you from SIVA to make you have an active lifestyle. But that's not the only thing that makes you happy, and our products are designed with that in mind. The next step in our journey of redefining the way that people interact with their bodies leads us into one of the most discussed industries of the last decade, telerehab. Imagine your mother is walking to her kitchen and falls, injuring her hip. She lands in therapy for several weeks, and due to her inability to see short-term progress, she becomes discouraged and ends up just going through the motions. That's not how it has to be anymore. In fact, with our garments, she'll be able to conduct PT from the comfort of her own home, which maintains her autonomy. She'll be interacting with concrete milestones with a personalized regimen, which will increase her compliance. And she'll be able to interact with objective data on a gamified interface, which only further heighten her motivation. So not only will her care be improved, but the cost can be reduced as a result of her therapist remotely monitoring her progress. Greg, this is the foundation for SIVA to be built upon, and I would love to start by empowering your health and your families. Thank you.
Thank you, Andrew, and I hope they'll be passing out those muscle shirts at the beer party tonight for all the men in the audience. So Greg, it sounds like you have some intriguing options to pick from.
Indeed.
What I heard are solutions that allow you to track your activity with the clothes you wear, to give you peace of mind by empowering others to provide care for your family members who need extra support, to give you personalized nudges to encourage you to act in the best interest of your health. So Greg, I'm guessing you have some additional questions you'd like to ask the companies.
I have a few.
All right, well, let's turn it over.
All right. Well, let's start with Carrot Hand. I've heard a lot of great pickup lines, but what is your value proposition?
Well, I care more about your personality, Greg, and not how you look, so I'll do it based on that. No, actually what I really care about more even than you, Greg, is truly your parents. In order for your parents to really derive value from all of the payers and providers that are in their healthcare ecosystem, those payers and providers have to meet your parents where they are, in their home, in the community, not in the ICU. And so we need to create value for those payers and providers and make sure that they are providing their care in the highest quality. That's why we are helping those payers and providers shift away from all of the extremely expensive delivery models that overemphasize people like me, the doctor, and rather emphasize the care team that's already around your parents, including you, including the workers around them. So we have evidence-based technology that has proven that we can take these non-medical workers and ensure they keep your parents from going to the hospital.
And SIVA, what's your value proposition?
Well, Greg, our value proposition is that we empower individuals to take control of their health by providing them with a heightened understanding of their bodies in a real-time and easy-to-understand platform that not only can be used as a preventative care measure, in order to live a longer and more fulfilling life, but also to optimize the minimal amount of time that individuals already have in order to work out and train. So not only will you be able to get the care that you need, but you can also use this data to further your development and your performance life.
And day two, what's your value proposition?
It's to make you stronger, to help you overcome the temptation that we talked about earlier today by giving you personalized nudges that spur you on to do the things that you've already decided that you want to do. You just faced obstacles in doing. For the health system, our value proposition is to give them a platform where they can activate a daily relationship with you. And they can configure that platform to reflect their care protocols, their brand, their mission. And finally, that platform has open APIs so that they don't have to introduce a new app. They can deliver these nudges into a variety of existing digital assets.
All right, back to day 2. You know, I really don't like the idea of friends with benefits, but what would I get out of a relationship with your company, and who'd end up paying for those benefits?
I really expected benefits, Greg, so this is startling. So the good news here is that our business model is actually to have the health system pay a license fee to be able to activate this relationship with you. It's incredibly important for them to get into your daily life. It's incredibly important for them to be able to get to the 40+% of adverse health outcomes that happen because of the decisions that you and I make every day and the 99% of the time that we're not interacting with the health system. So we have a license structure for the health system. We have payers that have begun to raise their hand and say, you know, I would subsidize that because I really want the health system to have that kind of relationship. And finally, we think that there may be some vendors like people that could pick up your parents and take them to an appointment that may want access, and they might pay to have access to offer that service to you.
Okay. Carrot hand, what would I get out of a relationship with your company, and who'd end up paying for that?
So Greg, to me, it's incredibly important that we as a software vendor don't perpetuate health disparities that are already pretty rampant. And so that limits us in terms of who we sell to, because we don't want limited purchasing power to preclude certain populations from being able to afford the benefits of our software. Because of that, and because healthcare is changing entirely towards outcomes-based reimbursement, we found that we've been successful in selling to managed care organizations, hospitals, post-acute care providers, folks that are basically at risk. And so the way we grow our business is we license our software. And what we found is usually within 3 prevented admissions, our software is paid for. The other thing we do and emphasize pretty strongly is we like to go at risk for our outcomes. We have science that shows we save about $9,000 in Medicare spending per year. We've reduced readmissions by almost 40%. And so we let our science do the selling for us, and that's why we're so comfortable going at risk.
Okay. And Siva, other than an awesome shirt, what would I get out of a relationship with your company, and who'd end up paying?
Well, an awesome shirt is pretty awesome, I will say that. But our customers will receive our products through some sort of upfront payment in which they'll receive the garment that they can use in their life. They're also able to then track their data over time through our software, in which they subscribe to a subscription model, which ensures us that we generate recurring revenue. In addition to that, though, larger entities like hospitals, training facilities, sports teams in general, they're able to also provide value from our software because we have varying complexities within it, so that whether you are, an elderly individual like your parents or yourself or your kids in college, all types of people will be able to receive specific types of care and data from our garments that can then specifically be tailored for whatever application that they're in.
Okay, and let's stick with Siva here. I've got a lot going on, and I get bored pretty easily. What would keep our relationship strong?
Well, what keeps our relationship strong is the passion that comes from us. We will do anything that it takes in order for you to be satisfied, whether it be your life, your family's life, your parents, whomever. Once you're happy, Greg, then we're happy. And we will put forth every bit of energy and time into that. And we won't settle, like I said, until everything is off the table and we are in the best position that we can be. But tangibly, what can we do? We provide our garments that are already made with common materials that our athletic individuals are already used to, so nothing's encumbered. It's comfortable, it's stable, but we blend this unique, flexible sensor material that is able to then detect all these responses, so you basically are able to go for a run as if you go for one right now. You can pick up shorts like you would at Sports Authority, nothing is different. But in addition to that, you're being given this data, these values, these metrics that will allow you to be the best person you can be, in addition to your parents and your kids being the best that they can be.
And day 2, what would keep our relationship strong?
I think variability in the places we make whoopee. I'm kidding. I'm kidding. So Greg, the first thing to remember is that these nudges are powered primarily by data about you. And so they're going to be sticky in the similar way that Mint.com is sticky or Jawbone Up is sticky. Secondly, the provider is going to be nudging you along. They're going to prescribe to you this experience. They're going to prescribe it to you. They're going to prescribe it to your folks. And so they're going to be consistently trying to nudge you back into the experience. Thirdly, remember that this is not an app. We're talking about delivering nudges in a variety of different places, hopefully the places where you're already having an experience that we can add to.
Okay. And carrot hand, what would keep our relationship strong?
Where do I go from here? I have no joke. Well, I think what's important to note is if you're activated enough to be bored, Greg, then you have the luxury of being bored. And I say that because this notion of patient or consumer activation becomes so important with the people we work with. Some folks are so ill or have so little health literacy or have so many upstream health determinants that even if they knew the right things to do with their health, and even if they comprehended what was told to them as like, this is what you need to be compliant with, they may be in too much pain to be activated enough to follow those directions. So what we do is we don't focus directly on you, Greg, or even your parents. We focus on the workforce around them and ensure that through that workforce, they get the supports. And hopefully it never happens, but in the case of, let's say, mental illness or chronic disease, that workforce around you could also be helpful, and we augment them.
Great. Well, thank you, Greg, and thank you, companies. We have time for a lightning bonus round, so I'm going to ask the companies one last question. Day 2 Health, if you were to pick a celebrity spokesperson, who would it be and why?
It'd be Dan. Dan, who spoke to us today, because he understands behavior change. He's incredibly engaging, and he doesn't take himself too seriously.
Great. And Carrot Hand, your celebrity spokesperson?
I would pick anyone who is thriving in the community with a chronic illness and or a disability and not letting that disability stop them. And there's countless celebrities out there. I mean, we could have the Michael J. Foxes. We could have, I think Iggy was his name. He had spinal muscular atrophy. People that may be hampered in some way functionally, but still are able to go out and enjoy their lives. And that's a theme that we always try to emphasize, which is it's not all about medicine. It's certainly not all about doctor-centric things. It bothers me when I hear doctor-centrism. It's about what can we do to help consumers, not patients, meet their goals and be happy. And if you happen to be a celebrity doing that, that's awesome. And I think there's too many to count. And I also would say that focusing on the celebrity may be focusing on the wrong folks. I think there's a lot of people that go unsung that thrive every day with chronic conditions and are able to be happy, and that should be celebrated.
Thank you. And Siva, your celebrity spokesperson.
Well, if I had to pick a fictional one, I'd say the Incredible Hulk. And if I had to pick a real one, I'd probably say Dwayne "The Rock" Johnson. Because I'm not sure there's any other celebrity out there that knows their health better. I mean, look at him. He gets it.
Great, fantastic. I'd just have to stand up here so I can see my judges. I think the judges, and actually see the contestants, I think the judges may have a few questions for the contestants. Can I turn it over to you guys?
Great, I'd love to ask a question of Siva. Siva, let's say you, Greg, and Mayo Clinic decide to take this relationship to the next level. What would you expect Mayo Clinic to bring to that relationship?
What we expect from Mayo Clinic would be the opportunity to throw our garments through the rigorous trials that are in the medical realm in order for us to design specific medical claims in which that we can back our garments with. So not only will it be the general understanding of your health and your body, but instead it can become a more specific and tailored garment for individuals across.
I have a question for day 2. So given your variability comment earlier, I'm guessing you're trying to make relationships with many got health Gregs. How are you going to measure success?
By the effectiveness of the nudge. Ultimately, we're going to have to get paid that way as well. So our idea is that our big goal is 1 billion people 10 billion daily nudges. So we have a global goal for this. And the idea is that we're sending this daily stream of nudges, and we're measuring, and we have in our system the ability to measure how effective they were at actually getting that change to happen.
Thank you.
I have a question for Carrot Hand. You seem like the quiet type and work in the background. Can you clarify for the audience how your relationship with health systems ultimately ends up being beneficial to Greg and his family?
Happily. I could give you an example of how 2 health systems right now that we're working with helps people like Greg. So we work with Trinity Health System in Michigan and Rush Medical Center in Chicago. And so there's lots of God Health Gregs out there. Those systems are helping patients to transition into the community. Trinity is using community health workers. Rush is using social worker coaches. And by helping these consumers and patients get out into the community safely, Greg, who has to go to work and pay all these bills, doesn't have to worry about, is mom going to take her meds appropriately? That'll be covered. And also things like, is mom going to come home to an empty fridge? That'll also be covered. And so all of these determinants of health that oftentimes we miss out on, the adult children don't have to worry about because there's this care team that's already built in. Now that's amongst the early adopting health systems. And nudge, nudge, wink, wink, Mayo Clinic this is one way that I think it can really distinguish itself by focusing on the non-medical workforces it already employs.
Thank you.
Thank you.
Well, thank you. Please, audience, let's give a round of applause to our fabulous God Health Greg.
Good luck.
Great. And to our judges. So now, audience, it's your turn. We're going to have you vote for the biggest impact for God Health Greg. We're looking for the company you think can help move towards healthier lifestyles and or help providers become more active partners in supporting Greg and his family's health. And for $50,000, please go to your Yorn app and vote for God Health. So instructions on the screen, click on Yorn under the menu, choose 701, the Think Big Challenge vote for the God Health session, click on poll and vote. All right, welcome back. Our second challenge for the evening is I Am Not My Disease. Please help me welcome to the stage our second guest for the evening, Kristen Coppins. By way of quick introduction, Kristen is a social media specialist for Spectrum Health and is excited to be so heavily involved in Transform this year. And she also writes a blog called Chronically Kristen about her own experience with chronic disease. So let's give a huge Think Big welcome to Kristen Coppins, Chronically Kristen.
You're rocking it.
I'm rocking the best,
yeah.
All right. Well, thank you, Kristen. You've taken a little bit of time to highlight a few things about yourself and your life situation for the room. Are there other things you'd like the audience to know?
Yeah, you know, to kind of paint a picture of I am not my disease, I wake up in pain. I go to sleep in pain. I no longer know what it feels like to be pain-free. I walk around so exhausted that I feel like I have a weighted lead suit on, and I feel like I have the never-ending flu. So you can imagine how difficult it is to try and focus on living the rest of my life as normally as possible. I get through it, but how can I live and not just get through it? People like me, who are no stranger to the healthcare system, struggle with the balance of being a chronic patient their entire lives and being a whole person. What I like to say is chronic disease never parties alone. We tend to have multiple chronic conditions, so we need transparency, trust, and opportunity to manage these conditions and still live our lives to the best of our abilities. How will health technology empower us to do this? How will you help me enrich my life outside of the chronic condition?
Thank you. So talk a little bit about what motivates you, what concerns you.
Sure. You know, I'm very determined to live my life to my full potential, and it's very important to me to have a physician, to have a company, to have the healthcare system see me and know me and care for me, and not just a patient and not just a chronic condition.
And how about what frustrates you the most?
You know, I think the conditions themselves are very frustrating. Having chronic conditions are very frustrating, but not having the right tools to stay organized with my medication or broader treatment and therapy plans is also frustrating. Uncertainty about my condition changing, taking one step forward and 2 steps back, and the fear of the unknown are frustrating.
Great. So if I'm hearing you right, it sounds like you're seeking solutions that will empower you to be in the driver's seat of managing your own conditions.
Yes.
Terrific. Well, the good news is we've got 3 companies that might have just what you're looking for. So I would like to introduce Livongo, Well Pepper, and FizIQ. So let's start with Livongo. Livongo, why are you a good match for Chronically Kristen?
Well, thank you for asking. I believe Livongo is a great match for Kristen for a lot of reasons. But one of which, maybe the biggest, is that our success we've enjoyed to date starts with our understanding. We understand the feelings of isolation, frustration, guilt, and loneliness. But in reality, Kristen's not alone. There's tens of millions of Americans living with chronic conditions today. In the US, roughly 30 million Americans are living with diabetes alone. And for too long, we've defined them by their disease. Have you ever thought about why we call people by their disease a diabetic? Would you ever call somebody a cardiac or a cancer? Think about that. And they've had to stand by and watch as every industry, from retail to transportation to banking, has been transformed by technology. And for too long, we've placed the burden on better health solely on their shoulders. And we stand by in bewilderment and frustration as we watch quality of life deteriorate and costs rise. The innovation challenge for us in this room, all of us in this room, is not how to get better outcomes, whether they be clinical or financial, by asking people to do more. That's not innovation. If people do more, spend more time, they should get better results. The innovation challenge for us in this room is how do we bring to bear technology and tools to make things easier, to make things simpler, to allow people to spend less time on their disease and more time living their life. And that's what we've accomplished here at Livongo. So Kristen, how do we do that? Imagine for a minute you're a person living with diabetes. You're going to start with free and unlimited supplies from Livongo. You're going to check your blood sugar using our new FDA-cleared InTouch glucose meter, which is cellular-enabled, highly accurate, touchscreen, and easy to use. Once you check your blood sugar, that data is going to get to the cloud in real time with no additional effort, no additional steps, or no additional technology. We're also going to get a couple pieces of contextual metadata within a couple of seconds, before, after a meal, and how you're feeling, because we know you're not just a number. Once that data gets to the cloud, we're going to aggregate it with other information we know about you, whether you have type 1 or type 2, whether you're on insulin or on orals. And we're going to combine that. We're going to aggregate it, analyze it, and what we're going to do is synthesize it into timely, actionable, and personalized information, which we're going to push out in the form of digital coaching and education, right back to the meter while you're holding it in your hand, or to a smartphone if you'd prefer. And if we see something that we can't correct digitally, a trend, for example, or something more acute like a severe hyper or hypoglycemic event, a certified diabetes educator from Livongo is going to reach out in real time and engage with you in that moment when you want and need the help. And as some indication of those of you who have ever tried a traditional telephonic disease management program with low single-digit engagement rates, when Livongo reaches out to build that relationship, to engage that member, we reach them over 80% of the time. 80% of the time, because they've invited us in for that brief moment. So, what are our aspirations at Livongo? Today, we're empowering people with chronic conditions to live better, and we're starting with diabetes. But we're not going to stop there. We're going to keep on empowering people with chronic conditions of all kinds to live better. And ultimately, we're going to empower millions of people around the globe to simply live better. And when we've done that, and we will do that, we'll feel like we've achieved success. So Kristen, thank you for coming with us on that journey, and I'm excited to answer any questions you might have.
Thank you so much. Next up, Wellpepper. Why are you a good match for Chronically Kristen?
Hi, Kristen. I'm Ann Weiler. I'm the CEO and co-founder of Wellpepper. And we are the perfect match for you because we'll deliver a personalized care plan that is based on best practices from your care team. We were inspired by people just like you. Like you, my mom has a chronic autoimmune condition. It caused her to become temporarily paralyzed and spend 6 months in a rehab hospital. When she was discharged, she was sent home with no instructions and a month before a follow-on check-in. We were confused, we were frustrated, we felt lost. Now, my background in technology, my whole career has been spent building productivity and communication solutions for a global audience. So I was struck and really frustrated at this poor communication at such a crucial time, and I wanted to do something about it. So I called my friend Mike, who's also a colleague from a prior startup, and we started to look into the patient experience. And what we found is that patients want to actually adhere to their care plans, but they can't because they don't understand them. They're confused, they feel like my family did, they feel lost. And so then we went and we looked at countless protocols, best practices, and instructions from healthcare organizations. And quite frankly, we found that the instructions are pretty confusing. And sometimes they're even conflicting. So we built Wellpepper, which is a clinically validated platform for digital patient treatment plans. Kristen, here's how Wellpepper will help you. Your healthcare professional can create and prescribe your custom treatment program, and it's based on their own best practices and protocols. Wellpepper patients are over 70% engaged with their care plans. This is because they understand them, because they're reminded when it's time to do something, and because they get remote support. Kristen, in your care plan here, you set your goal, you get your daily tasks, you can track your outcomes, things like what are your pain levels like? Are you using pain medication? Are you able to adhere to your physical therapy program? Now, in your blog, you said that you have trouble with your physical therapy program. You know, a lot of people do. This is a place where instructions are pretty confusing. And that's why Wellpepper provides you with video of yourself doing your program with the cues that your care team recorded just for you. So you're going to be able to understand this really clearly. Now, we want to help support you in your goal of living life to the fullest, and we want to help you manage your health. Now, sometimes when you're managing a chronic disease, it feels like you're really just managing a decline in your health. It doesn't have to be that way, and we've proven this. Boston University did a randomized clinical study with Wellpepper with people who have Parkinson's. Now, the average person with Parkinson's experiences a 12% decline in their mobility from the year that they're diagnosed and every year beyond that. The patients who used Wellpepper for digital treatment plans and remote check-ins saw a 9% increase in their mobility, and this was over the course of a year. So with Wellpepper, we can improve care, we can enable health systems to track outcomes in real time, We can enable them to adjust care plans and collaborate. When you're tracking your results over time, you can understand what's working and what's not working and work with your care team to change your treatment plan to really deliver that better care. And all of these things are really important, but what's most important is that we can improve quality of life. And this is our biggest aspiration, and this is why you should choose us.
Thank you, Wellpepper. So next up, PhysIQ. Why are you a good match for Chronically Kristen?
Well, thank you, Kristen, for sharing your story. We at PhysIQ are your perfect match because our technology was literally custom developed for you. That is, because it is based on artificial intelligence and machine learning, our technology is actually custom developed for everybody. And that's important because while there are over 120 million people with chronic disease in this country, no two people are sharing the same experience, and no two people share the same physiology. Now, what's really cool is that we've got these new wearable devices that are offering unprecedented amount of physiological data. And what we do at PhysIQ is to take that physiological data and transform it into personalized models of vital sign patterns. Personalized models that reflect what everybody's physiology is doing. And it's through this that we're able to apply personalized models to learn your story and personalized models to allow you to see around the corner, potentially get ahead of your disease, and be in a position of control so that you understand what's happening before it's happening. So that's why we exist, to take data from wearable devices and transform it into personalized information that patients can use for individualized care plans. So the way this works, Kristen, is that we're going to take the data from your wearable device, continuously streaming data such as heart rate, respiration rate, and activity. And what's interesting is that, as you can imagine, this data is going to change throughout the day as you go through your normal activities of daily living. And the activity here, the activity tracker that we have within these sensors is really important because it allows us to characterize what is actually happening with your vital signs as you're engaged in these activities. And so we take this data and we learn your physiology, and we learn the pattern between your vital signs, and we establish a baseline reflected here. Now this baseline then is the yardstick by which all your new data coming in is going to be measured. Now this is where the real personalization comes in, Kristen, because our system learns you, our system learns the relationship between your vital signs, and it can then detect very subtle deviations that have the potential to be an issue down the road. Subtle deviations that might indicate that your health is fundamentally changing. Now, we don't expect you, Kristen, nor do we expect your care team to actually look at data like this. So what we do is we sum those differences between the baseline and the actual up into a single index that's showing overall change in your vital sign patterns, change that could be indicative of something important that's happening that you should be aware of. Now the impact and our aspiration is really told well by this story right here. This is data coming from one of the heart failure patients, one of our clinical studies. And this patient was discharged for heart failure, and she went home wearing a wearable device. And the system spent the first day or so learning her unique vital sign patterns. And then it flipped automatically into monitoring mode. And you can see for most of this month, as this patient was wearing this device, the system was seeing what it expected to see. And so this index is low. But then down the road, you can see the index start to change. Now the index started to change, though, in advance of that patient actually recognizing any symptoms. Ultimately, the system detected a heart failure exacerbation in this study over 8 days in advance of this hospitalization. Now this was an observational study. And so the goal here wasn't to intervene, but the goal was to see how far in advance the system could actually detect this change. Now imagine, Kristen, if you had 8 days to respond to your physiological changes before they actually manifest in symptoms or before they manifest in acute care event. And imagine what that could do for the millions and millions of patients who are in a similar situation as you. Thank you.
Great, thank you to the three companies. Kristen, what I heard were solutions that provide you with, number one, a complete solution for people managing chronic diseases, starting with diabetes, Livongo. 2, a platform to aid with care plans to ensure coordination with providers, WellPepper. And finally, PhysIQ, a platform to proactively know when something might be going off the rails. I know you have some very specific questions you'd like to ask the companies. You want to take it away?
Sure. WellPepper, what are your most attractive features?
We're very attractive. We were really built to focus on the patient and humanize the experience. So that's why our logo is a dog. Our application will actually bark at you to remind you when it's time to do something, which some people find attractive and some people don't. We have an adaptive notification system, and it changes based on patient behavior. So depending on whether you've come into the app recently or whether you're being adherent to your care plan, you'll get different messages. So you don't have that message fatigue that you sometimes get when your mobile device is asking you to do something. And we really focus on making it easy and not overwhelming for you. So when you come in, you'll only see the tasks that you need to do at that time and on that day. So you don't need to be worrying about this whole big stack of papers that somebody may have given to you to try and manage your care. But our focus is really on that the patient or the person-facing application is as easy to use as any of the great consumer apps out there.
Great. PhysIQ, what are your most attractive features?
Well, clearly our development team. There's some handsome programmers. But beyond that, I think there are a couple things that really stand out. First, we're not actually asking the patient to do anything but wear a wearable device. There's nothing that they have to enter. We are looking at their physiological data and only their physiological data. We're letting the data tell the story, and so that's really passive monitoring. Nobody has to step on a scale. Nobody has to put their arm in a blood pressure cuff. Nobody has to fill out anything on a phone. That's first. And second, it really comes down to that personalization. It is using artificial intelligence and machine learning to really understand that individual's vital signs so they can establish that baseline and we can start to see those deviations from that baseline. So it all comes down to an N of 1. We call it you-to-you comparison, not comparing you to a population, but comparing you to you.
Okay. Well, Livongo, what are your most attractive features?
Great teeth and a trust fund. Perfect. We have a truly innovative, market-leading glucose meter, but that's not our most attractive feature. And we have an incredibly intelligent analytics platform in the cloud, but you'll hear a lot about big data in the cloud and smart this and analytics that, and that's not our most attractive feature. And we have really, really good AADE certified diabetes educators, many of which who live with the disease every day and who know and empathize and can engage with people, but that's not our most attractive feature. It's the aggregation, it's the full seamless integration of those pieces together into an experience that transforms the way we manage a disease. And if you think about what Apple did with digital music, they didn't invent the digital music player, the MP3 player. They didn't invent digital music, and they didn't invent online retailing. What transformed the way we engage with digital music was the seamless integration of hardware, software, and people services. High tech meets high touch in a way never seen before. And that's what we're doing at Livongo, and that's core to what makes us so successful.
Okay. So it is important for a partner to really know me. PhysIQ, how does your solution get beyond the medical me to the whole me?
So when we think about our solution, the context of the person, obviously emotions and behaviors are a huge part of that. Now, what we see is the opportunity to have feedback loop whereby a change in vital signs or a change in underlying physiology can actually be indicated to a patient in a way that they can then make changes based on what they see. So if you think about the heart failure patient who currently has a bag of potato chips and then 3, 4, 5 days later, because of that sodium intake, starts to deteriorate towards exacerbation. Well, what if you're able to show that patient the impact, the true physiological impact of eating that bag of potato chips, so they can then start to connect the dots around what they're doing, what's happening within their system, and the behaviors that are either contributing to that or degrading from that.
Okay, WellPepper, how does your solution get beyond the medical me to the whole me?
We have to look at the whole you because you're allowing us to be on your mobile device, which is really the closest thing we, I think, all have to a partner these days. But what we do is we learn from your behavior. So our patent pending adaptive notification system learns from your behavior about when you come into the app. When you come in, you're then recording your outcomes and then communicating that to your care team so that they can start to adjust based on the input that you're putting in. So we are really a conduit to improve your tracking of your own health and your communication with your care team. And your care plan is based on the best practices and protocols from your care team. So they're really the ones who are starting to get to know you better and improving your care based on your feedback and the things that you're doing in the application. So we're really connecting you to their best practices and protocols through a very engaging and easy to use interface.
Livongo, how does your solution get beyond the medical me to the whole me?
Yeah, it's a great question. And I recognize that I may offend some of the patient engagement and member engagement folks in the room. But you think about the medical me, and you think of this concept of engagement. If you stop and think about it for a minute, this isn't a hobby. It's not a grandchild or a spouse. This is a chronic condition. And the idea that we want people to be more engaged with probably the least favorite part of their day is not going to work. And it shows, I think, a lack of understanding. So what we've tried to do is create these perfect moments. I'll use an example outside of diabetes that maybe many of you can relate to. If any of you have had young children and at 2 o'clock in the morning, your 2-year-old wakes up with a 104 fever and you're trying to figure out whether or not you're going to give them ibuprofen or Tylenol, or do you take them to the urgent care clinic? And all of a sudden, at that moment, your phone rang, and it was your pediatrician. She said to you, Jim, I understand you might need some help right now. What can I do for you? You would think that moment was magic. And that's the moment that we've created for people. And in that moment, we're allowed to engage with them. They've invited us in to talk about diet, nutrition, exercise, mental health issues. And so we engage far beyond blood glucose values, and they invite us into their lives for that brief moment. And that's how we get at the whole me.
Great. Well, they say that you can tell a lot about a person by the company that you keep. Livongo, who are some of your current customers or pilot sites?
Yeah. So we've been in market since September of 2014, and we've been very fortunate to get a lot of traction and had a lot of early success. We actually have dozens of clients today. Tens of thousands of people have access to the Livongo for Diabetes solution. And we're starting to see some really early success signs show up in both quality of life, clinical measures, and financial. Our current customers are large Fortune 50 employers, big box retailers, not located in Bentonville, Arkansas, other folks around the country, large health systems, so folks like Mount Sinai in New York, Mission Health in Asheville, North Carolina, and health plans like Optima in Norfolk, Virginia. Really anybody who has risk for a large population of people living with diabetes who cares about both wowing and improving the experience for those individuals living with diabetes, but also wants to reduce cost and improve clinical outcomes. Thank you.
Well, Pepper, who are some of your current customers?
So we sell directly to health systems. Anybody who realizes that our current way of delivering a stack of photocopies to a patient and wishing them good luck is not going to get us the outcomes that we need. And so these are organizations like Evergreen Health in Seattle who are using us for preventative and post-acute scenarios for orthopedics, like Centera in Virginia, who are using us for neurology scenarios. And then some of the company we keep is certainly researchers. So we believe really strongly in collaborating with researchers. So we just announced last week a study with Harvard Medical School researchers and Brandeis School of Public Health. And that one is aimed at looking at not just the efficacy of using digital treatment plans, but the costs, so that we can prove that it's actually cheaper to proactively manage patients this way than the usual care condition. And we're also, we continue to work with Boston University on additional Parkinson's research. and we're working with the University of Washington in Seattle, where we're based.
Great. PhysIQ, who are some of your current customers or pilot sites?
We're particularly proud of the ongoing relationship we have with the VA. As many here may be aware, the VA is the largest user of remote monitoring in the world. They have a goal of monitoring over 250,000 patients, and they also don't want to be in the business of building hospitals anymore. But in order to do that, they have to be able to deliver quality care with clinical-grade analytics from patients' homes. And so after an early grant from the VA, early in the history of our company, we're now in a phase 2 study, pilot implementation with the VA across 4 different hospitals within 4 different regions in that system. Beyond that, we just recently finished a very exciting study with the Scripps Clinic, applying our remote monitoring solution to monitoring Ebola patients in Sierra Leone. And this particular program was funded by the CDC and the USAID, the idea of monitoring these patients early in the trajectory of their disease. And last and certainly not least, we are thrilled to be involved in NIH-funded study here in heart failure, right here with Mayo and Dr. Charles Bruce.
Fantastic. Thank you, companies. So we do have time for a bonus round, and I'd like to ask each of you, first Livongo, if your company were to have a mascot, who or what would it be and why?
Mascot. The Staples easy button, maybe. The idea that we can simplify, reduce, help people spend less time, less money, less hassle, but get the results they want, to spend time living the lives they want to live, focus less time on their chronic conditions, and do it with a simple, easy button, not just for the person living with diabetes, but those caring for them and those paying for them. That would, I think, encapsulate the spirit of what we're trying to accomplish.
Terrific. And Well Pepper, you've already introduced your mascot, so you can pick that one or tell us about another mascot.
We have a mascot. The reason we have a mascot is that dogs support you. They want you to get better. They keep you active. And so it's important to us to have a dog as our mascot there helping you and helping you humanize and feel, I guess, maybe affection towards your Well Pepper care plan.
And does your dog mascot have a name?
His name is Pepper.
Pepper, wonderful.
So you can
okay.
say,
there you go.
Well Pepper.
So last but not least, PhysIQ, who would be your mascot and why?
Well, so, in the spirit of animal mascots, I'm going to come way out of left field here. I just came up with this one. I think our mascot would be a bat. As my son likes to say, bats have echolocation, and they can see things in the distance that are really hard to see. And that's really what our technology is geared to do.
Great. Thank you so much. So back to our judges. I'm going to go over and take a look at the judges again. Do any of you have questions for our 3 contesting companies?
I have a question for Well Pepper. Your platform seems incredibly flexible. Tell us how that enables you to work across a range of clinical conditions.
Thank you for noticing. It is very flexible. We don't have content, so we are not directing the care plan. We have building blocks. They are task-based building blocks, and so they can be assembled in any way to basically, our goal is to replace all paper-based care plans. So we can do that at this task-based level, and then each task is reporting outcomes. So you can start to do things that you could never do before. For example, look at pain across all kinds of chronic conditions and compare that, or look at pain scores across all kinds of post-surgical, and look at that by patient type and look at that by physician type. So, I think the flexibility comes in that we partner with our customers to help them implement their best practices and protocols, and then we can learn from that. We can learn at a task-based level what works and what doesn't.
PhysIQ, in addition to bats, it seems like there's an awful lot of technology in your solution. So what technology requirements do Kristen and her care providers and PhysIQ need for this relationship to be successful?
So it's actually, the technology is relatively simple in terms of the user piece. So it's a wearable device that transmits continuous heart rate, respiration rate, and activity. Then that transmits to the cloud, or actually translates via Bluetooth to a phone, to the cloud where we do our analytics. That information then is returned to a monitoring clinician who sees the result of those analytics through a web-based portal.
Okay.
Thank you.
Livongo, you're doing great at meeting the needs of those Christians managing diabetes today. But how will you expand to meet the needs of Christians tomorrow?
Yeah, it's a great question. Over 70% of people living with diabetes have multiple chronic conditions, and we recognize that to have an impact on the millions of lives around the globe, addressing other chronic conditions, especially those highly correlated with diabetes like hypertension, obesity, high cholesterol, will be an important part of our strategy. We believe that the basic premise, this ecosystem we've created that includes real-time, accurate information, smart analytics in the cloud, and intelligent coaching both digitally and with highly skilled, competent people, can apply across the chronic condition continuum, not just to diabetes. We're starting with diabetes because it's an infinitely measurable chronic condition. 30 million Americans are struggling with it today. It's a global epidemic, but we have a vision going far beyond just diabetes and think our platform is well positioned to go beyond diabetes.
Fantastic. Okay, audience, now it's your turn. Which of the solutions, we're going to ask you to vote in just a minute, will have the biggest impact for chronically Kristen, which will help empower her to be in the driver's seat of managing her condition? So before we vote, I'd like to give a big round of applause to our 3 companies and to chronically Kristen. Thank you.
Thank you.
So now on to the voting. You know what to do. Voting now for I Am Not My Disease. And we will soon unveil the winners. Okay, that's it for the voting. We are now going to invite all of the companies back on stage and reveal your choices for the winners of both the God Health and the I Am Not My Disease competitions. So companies, if we can have you come on back up. And now I get to see you.
Stop here.
Stop here? Yeah, you guys are moving across. Yeah.
Across.
And we have Greg and Kristen right in the middle. Thank you. Yeah, thank you. You guys stay here, so you guys are in the middle. Fantastic. And I believe we have, Dr. Otley will be delivering the winners. Thank you so much.
A lot more complicated than Match.
It is indeed. So I have for Greg, God Health. I have for Kristen, I Am Not My Disease. Greg and Kristen, please reveal the big reveal. So Greg, the winner of the God Health competition is?
Carrot Hand.
That's what you look like.
And Kristen, I Am Not My Disease Coppins.
The winner is Well Pepper.
And I believe we have checks for the winners. We have checks for the winners. So
I've always wanted a judge
I think
stack
we go.
coming.
I'm saying, yeah.
Thank you. Thanks.
Oh yeah, you wear it the other way. Try it this way.
Oh, wow.
A new look.
That's a big one.
Well, give it our best shot.
That's a very large chair. Thank you.
Thank you.
Thank you.
Thank you so much. I really appreciate yours.
Was it?
Thank you.
Yeah, you guys did a great job.
We're in the middle of you guys. Thank you.
I like that number.
So a big hand for both of our winners. Thank you. You're doing the closing.
Everyone just
I want a picture with Carrot Hand.
Sure.
Care planning seems to be important.
And while they're getting their picture, I'm going to say thank you to everybody. I want to thank the judges. I know a lot of time and effort was put in.
Congratulations.
I don't know about you, but I had a really tough time deciding amongst these contestants. And frankly, I think we had a really tough time getting down to 6. A lot of very high quality submissions, a lot of tremendous ideas, and frankly, a lot of tremendous people. So it was a very big challenge for us, but we really appreciate everybody taking the time, the entrepreneurs, Avia, our judges, and of course, all of you. So thank you very much. We hope to see you over at Chateau.
See you at the Chateau. Party continues.
Thanks, everybody.
Thank you, everybody.
Congratulations, you guys.
Congratulations.
Yeah.
Way to go, you guys.
All
You
right.
need to take this with you.